So I'm Dr. Ol Pamela, a pediatrician working in Lacho Hospital and managing the in charge of the oncology units of Lacho Hospital. We have quite a number of children with cancers, and the commonest being Burkitt's lymphoma, followed by Wilms tumor, and rhabdomyosarcoma is the third. However, we are also seeing increasing numbers of patients with leukemia. And in the last 1 week, we have actually, in the month of May alone, we have had about 5 cases of leukemia, which we have referred for management in Mulago. Burkitt's lymphoma has a very good outcome and survival rate, as well as Wilms tumor. But survival depends on early diagnosis. So if this patient comes early, and screened early and they are detected early, their outcome is good. But if they come late, also their chances of survival reduces. And the challenges we have been having is some of them really come late in stage 4 or 3, of which most of the time you're doing palliative care. So for cancer patients, early diagnosis is key in their survival. For now, the sensitization going on and the screening going on has really helped bring some of the patients early. And so the major challenges we are having is still that people tend to believe that once you're diagnosed with cancer, it's a death sentence. And it's usually, and I think usually this leads to patients being hesitant to come for care, and some of them seek alternative care for their children. And by the time they come, usually it is late stage. And they have been to several clinics, and sometimes they have been misdiagnosed and they are on other treatments. So by Lacho being a referral center, sometimes receive patients really late. And secondly, because we don't manage all type of cancers, we are actually supposed to be managing majorly the lymphomas. So patients tend to be very hesitant if you want to refer them for treatment in Mulago because of challenges of language barrier. They don't know the place, it's new to them. So one big challenge we have is referring patients to Mulago for care, those who need cancer, those who need treatment from Mulago, especially the leukemic patient and those who will require radiotherapy after treatment. Another challenge is, I think, also patients coming from very far away. Most of our patients are from Lira, Karamoja, Kaberamaido, that is like, and then West Nile region, it's where they come from. And we are receiving patients as far as South Sudan who are referred here for treatment. And these patients usually come and they have a lot of social aspects, which sometimes it's really difficult to deal with them. Another challenge we are really facing is the psychological support for this patient, especially the adolescents who understand more than the younger ones. They really need a lot of psychological support, and I think if we can get a clinical psychologist for them who will sit with them and probably do continuous psychotherapy, and some of them are actually depressed because of their diagnosis. And every day during the round, you find one who has broken down, and you need to spend time trying to talk to them and counsel them. Solitaire is doing quite a lot in the support of cancer treatment, because without their help of referral of patient and providing the home care, the family home for this patient, it wouldn't be possible for this patient to stay here this long. These patients stay here, some of them stay for a whole year, where they need to be fed and they need a place for accommodation as they get their therapy. So I think what Solitaire is doing is really great, and we thank them, all the donors, all the supporters. We thank Solitaire for their support to the cancer treatment, and we hope that they continue supporting us and supporting these children, and we continue working as a team, as cancer therapy is really a multidisciplinary approach. You can't just do the clinical aspect and leave out the psychosocial and the other support that they need. So really, thank you very much, Solitaire, for supporting children with cancer.